Some symptoms seem harmless, but what if you're also ignoring a more serious one that indicates having a certain illness? Without a doubt, it's worth knowing these changes to be able to see if something is wrong so you can visit your doctor in time. Your body has a way of speaking to you, and it's important to listen carefully to what it tries to tell you. The ways to do that would be to pay attention to signs that it gives you, such as changes in the color of your body parts or sensations and desires that you find uncommon. Here are 10 body signs you should never ignore. 1. Hair loss. A person tends to shed on average about 100 hairs per day. This is caused because hair follicles go through certain growth stages that can last from 2 to 8 years. Once the growth stage is over, the hair strands fall out and new ones begin to grow after a 2-month rest. This means at one point in time, about 80 to 90% of a person's hair is growing while the rest is shedding or is in a resting phase. Losing some hair in the shower is nothing to feel alarmed about, but if you're beginning to notice a significant difference in your hair thickness and are losing more strands than you usually do, it may be indicative of another problem. Hair thinning can mean many things, the more serious issues being an endocrine or autoimmune disorder like thyroid disease or lupus, Dr. Gaither explains. Of course, it can also be something with a much easier fix like a vitamin deficiency, so make sure to talk to your doctor. If, however, you've noticed more significant hair loss, be sure to consult your doctor as a number of diseases could be the cause, including skin infections, thyroid disorders, and autoimmune disorders. 2. White stains on teeth. This is also known as dental fluorosis, a chronic disease that develops either before teething or after, when consuming large amounts of water or products with a high content of fluorine compounds. There are also 5 different types of fluorosis classification, which are questionable, very mild, mild, moderate, and severe. The first 3 variations tend to manifest visually through the appearance of stains, while the last 2 lead to decaying teeth tissues and teeth crumbling. 3. Foot deformity. The displacement of a foot bent inward and a change in the shape of the foot characterized by the omission of the longitudinal or transverse arches may indicate a flat foot. Studies show that transverse flat foot, combined with other deformations, tends to occur more often than longitudinal flat foot. In addition, women are generally more vulnerable to it due to wearing high heels, which cause an uneven load distribution. Heels tend to put the biggest load on the area of the transverse arch. When this arch isn't able to stand such a load, the foot can get unpleasant, painful, pulling sensations, which indicate the beginning of a deformation. Sometimes your body can get bloated in other places besides the abdomen. When that happens, you may find your feet or ankles swollen. If you've been on your feet all day, swollen ankles can be due to that, but if you're finding persistent swollen ankles or legs, it can be edema. When fluid accumulates in certain areas of the body, this can mean a heart valve issue. 4. Dry hand and dry skin on the body. Your largest organ is your skin, and it can reflect the state of your health. If you notice your skin, especially your fingertips, has a yellow appearance, this can be a sign of jaundice, which can indicate possible liver or gallbladder problems. See your doctor if you have this symptom. Other skin changes you should never ignore include large, rapidly growing, bleeding, or otherwise unusual skin lesions or lumps, as well as suspicious changes to existing moles. Contact your primary care doctor or dermatologist to check out skin symptoms as soon as possible. During colder seasons, dry skin is normal, but using a moisturizing cream, consuming plenty of water, and taking vitamins are quite helpful. If these solutions don't work, visit a dermatologist as dry skin is one of the most common signs of diabetes and hyperthyroidism. If your skin is both rough and peeling and also tight and full of cracks, it may turn out to be dermatitis caused by a natural reaction to chemical exposure. 5. Dry heels. Dry heels could occur due to a lack of the vitamins A and E. It can also be caused by a presence of fungal infections that affects the overall condition of the epidermis. The last case usually goes together with numerous cracks and the yellowing of nail plates. If dryness and roughness persist, even after proper care and an adequate intake of vitamins, it may be a sign of endocrine disruption. Cracked heels may be unsightly, but they don't usually cause serious issues. Occasionally, severely cracked heels can get infected and lead to a skin infection called cellulitis. No matter what the cause of your cracked heels, there are steps you can take to treat them. There are also ways to keep your heels from cracking in the first place. 6. Red face. If we exclude natural physiological changes, such as a change in temperature, a massage, or alcohol consumption, there are 3 main reasons for getting red in the face. In women over 40, this is due to a decrease in hormone levels, which indicate the beginning of menopause. A red face may also indicate the presence of infections that cause dermatitis. Partial redness that is accompanied by sudden attacks of dizziness can signify pressure fluctuations that can be normalized with the help of special medicines. 7. Pale lips with a bright contour. If you notice a red border of the lower lip becomes swollen, and you see that there are small bubbles, it is likely that you are very sensitive to ultraviolet rays. What you can do in this situation is decrease your exposure to the sun and use sunscreen cosmetics. If you notice the same symptoms on the middle part of the lip, it could indicate vegetative neurosis. So, taking sedatives will become an important part of treatment along with anti-inflammatory ointments. A severe swelling and redness of the entire lip may indicate an allergic reaction, in which case be sure to pay attention to what cosmetics and toothpastes you are using. 8. Nail dystrophy. If you notice that your nails are changing shape and are becoming thicker and wider, this may indicate that you have heart problems. But you should remember that nail clubbing is not a disease on its own. It's only a symptom of a pathological process in your body that can be caused by multiple diseases, so you should have a full examination. A change in color or structure should be checked immediately. Thin and pale nails can be a sign of anemia and a lack of iron in the body, while yellowing can be a signal of liver and gastric tract disorders or a fungal infection. White spots and stripes may be due to a lack of zinc, copper, and iodine. And the nails can become very brittle when faced with a lack of vitamins, calcium, iron, and beta-carotene in the body. 9. Eyebrow loss. As people get older, they may notice hair thinning or loss affecting the head, eyebrows, eyelashes, and elsewhere. Over time, some hair follicles stop producing hair, and the hair shafts become finer. The hair also begins to lose its color, becoming white or gray. This type of hair loss is a normal part of getting older. Thick brows are a current trend, but they can also be a big health indicator. A periodical loss of eyebrow hair is quite normal, but if you notice an excessive loss of hair, as well as the appearance of bald spots or possibly a complete disappearance of the eyebrows, be sure to contact a doctor immediately. It can be connected to an excessive or insufficient level of thyroid activity. 10. Dry or cracked lips. When you have flaky, dry skin, this is a clear sign of an allergy. So, pay close attention to the cosmetics that you use. Be aware, too, of oral hygiene products, food that you eat, and medicines. Cracks that appear in the corners of the mouth may indicate a lack of certain vitamins, including B, A, and E. If you have dry eyes, a dry mouth, and problems with your digestive system, you had better visit a doctor because it can be a combination of symptoms, which are specific for an autoimmune disease called Sjogren's syndrome. Please let us know in the comments what you think about these signs. Please subscribe to The Health Awareness. Thanks for watching.